Hi, my name is Amy Webster, and I'm here today to talk with you about transportation barriers in Medicaid care. The Medicaid population is often the poorest of the poor. You'll typically find the Medicare population in low income areas or impoverished communities or rural areas. And many members face barriers to healthcare due to transportation issues. Um, Medicaid, whether it be traditional or managed care, Medicaid, offers benefits for transportation. I just want to talk a little bit about what that transportation barrier looks like in the United States and in Ohio. In the United States, 2.5 million Medicaid recipients under 65 receive delayed care due to transportation issues. Of that, 39% affected were children. In Ohio, almost 40% of Medicaid recipients do not have a vehicle or access to transportation. 1 in 5 have limited transportation skip their medical appointments, and adults with disabilities are 2 times as likely to have inadequate transportation. Medicaid offers a benefit that many recipients just are unaware of. And there are many barriers or reasons why there's a transportation barrier for our Medicaid recipients. No car driver's license, uh, cannot afford the upkeep of the car, so they may not have gas that day for the appointment, or the car needs a repair, flat tire. So the ability to afford those upkeeps affects their transportation. Uh, they may need the ability or they may need a special vehicle to help get a child with complex needs to medical appointments, or they themselves may have a wheelchair or a scooter that requires a special vehicle. The healthcare administration issues um, are limited transportation options for our members, underutilization of transportation benefits due to lack of awareness, and consequences of those our missed preventative care appointments, our reliance on emergency department visits, and higher inpatient admissions. So when you have a Medicaid member who has a complex issue, maybe diabetes or COPD, and they're not getting to their specialty list or their primary care provider, and they're letting their condition worsen until it's so bad that they have to go to the emergency room, that drives up cost. And when you look at that through the iron triangle of healthcare, transportation barriers limit provider or healthcare treatment or access. Quality of care, preventative care is missed, so that leads to poor outcomes. And when you have poor outcomes in health, that drives up costs through those emergency visits and adm- admissions to the hospital, inpatient admissions to the hospital. So the conditions, when you look at access, being able to provide transportation, so removing the transportation barrier will drive access up, which will drive quality up. So when people are able to get the treatment for their conditions, it will drive their health outcomes. Instead of up, it drives them up, so they'll have better quality of life. When access goes up and quality goes up, cost goes down. Some of the impacting conditions are geographic isolation. In rural areas and the impoverished areas, you may not find primary care providers right in those areas or even specialty care providers. So transportation really is essential in those areas to be able to get the treatment they need to keep, their health good and medical costs down. Socioeconomic barriers, when there's an inability to have transportation, uh, lack of vehicles, or the ability to pay for alternatives, that is a barrier that impacts. And then there's benefit limitations. The Medicaid benefit for transportation has scheduling challenges. There are limits to how many uh, transportation rides you can get through Medicaid. So those things reduce the effectiveness of getting Medicaid members to their appointments. Awareness gaps. Many members are not aware that they have a benefit for transportation, and that prevents utilization of that benefit. If you don't know you have the benefit, you're not going to use it. It's that simple. And system strains. Providers face overcrowded emergency departments. They're, uncompensated for some care. Um, there's burdens to not just the doctors, there's burdens to the nurses and other healthcare professionals in those emergency departments and hospitals. The impact on the healthcare administration is really transportation is a social determinant of health. We need for better communication and outreach. And by doing those things, it really does have a potential for cost savings through improved access and preventative care, and most importantly, improved health outcomes for Medicaid members. Recommendations that what I recommend is that we expand the scope of the transportation benefit, that we find ways to maybe tailor that benefit to the individual. Uh, some members may need 15 visits a year in transportation. Some may only require 3, but others may require more than 15 round trip visits, for example. Um, Typically, the transportation benefit just doesn't look at getting members to medical appointments. It also looks at some of the other social determinants like grocery store visits or to help get them to their local job and family services, Social Security, job interviews. So transportation isn't with Medicaid just used for doctor visits or special, to the hospitals for MRIs and things like, not elective treatments. Transportation is really about the whole, because you want members to be able to have adequate nutrition. It's especially important for somebody who may be diabetic. Um, so the transportation is used for a multiple of things. So maybe broadening the number of visits and maybe tailoring that transportation benefit to the individual. And we really need to do a better job at increasing member education and outreach. We need to get creative with how we let members know that this benefit's available. Partnering with local organizations for rural transportation solutions. In some communities, Lyft isn't always available. Uber's not available. Taxi cabs aren't available. Some members don't live on a bus line. And so partnering with, churches or even EMS teams, I've heard and seen that are doing things with transportation, and instead of just transporting to the hospital, they can set up systems where they can go to homes for some of that preventative care or sick care, um, which is a lot cheaper than an emergency department visit. Uh, we also need to look at how we are using technology. Sometimes by the time a member, let's say I'm the member and I've gotten a ride to my doctor's visit um, with a friend, a family member, because I didn't know about this benefit, or maybe I did know about this benefit, but I didn't need to use it today. So by the time I get home from that visit, the transportation scheduling area is closed. Now I have to wait until tomorrow to schedule my visit, when if I had an app, that I could just go on and schedule. It would make things a lot easier and improve scheduling and awareness. Transportation is a critical link in that iron triangle. Without access, quality declines and costs rise. Addressing transportation barriers can rebalance the triangle and improve outcomes. Thank you for allowing me to come and talk to you today about the transportation barriers that Medicaid members face every day. Thank you. Have a great day.